last week, Dr. Christian Threw, medical director for Pfizer Australia, New Zealand, and the company's head of regulatory sciences, Dr. Brian Hewitt, answered questions at a hearing in the Australian Senate. Now, during the hearing, some bombshells were dropped, like the fact the company didn't conduct many tests and can't figure out what causes myocarditis. Also, it turns out, their employees received a special non-quality control tested by the government batch of the vaccine. So like a special version that the government didn't dip its finger into to find out if it was actually the vaccine, when everybody else in the country of Australia were given vaccines that were tested by the government. So let's watch some clips from the hearing. We're going to start off with this question of whether or not Pfizer tested COVID-19, whether or not the vaccine could stop or reduce transmission of the disease. Watch this.
Thank you. Senator Canavan.
Thank you, Chair. Thank you, gentlemen, for appearing today and your evidence. Did Pfizer test whether your COVID-19 vaccine could stop or reduce the transmission of the virus before its approval and rollout in late 2020?
Senator, to bring this vaccine to patients, we were required to show that the vaccine was safe and effective in preventing illness, in preventing severe disease, and in preventing hospitalisations. The primary purpose of vaccination was and remains to protect the person who received the vaccine.
I'll just repeat the question. I appreciate that, but there hasn't been an answer to it. And perhaps I might just add into the record that on the 3rd of December 2020, your CEO, Mr. Albert Bourla, told NBC News, and I quote, when he was asked whether vaccinated people could carry and spread the virus, he responded to NBC News that, and I quote, "I think this is something that needs to be examined. We are not certain about that right now." So was Mr. Bourla correct that as of December the 3rd, 2020, Pfizer did not know whether the vaccine could stop or reduce the spread of the virus?
Senator, as with all vaccines seeking regulatory authorisation, the requirement is to demonstrate in robust clinical programs that the vaccine is safe and effective in preventing the infection, and in this case, in preventing severe disease and hospitalisation.
I might just give you one more. Sorry to interrupt, but I've got very limited time. I've got 5 minutes. So is it yes or no? Did you test whether the transmission would be reduced or stopped before the approval of the vaccine?
Senator, we designed our clinical programs in agreement with regulatory agencies, the purpose of which was to demonstrate the vaccine was safe and effective in preventing infections.
Okay. All right. We might just move on then.
So you could hear people laughing as he couldn't really answer that question. And the fact is that Pfizer only tested for whether or not it prevented severe disease. They did not really test it for transmission. And when they tested it for severe disease, it was very limited. It was very, very limited. And what we've now known is that the vaccine wears off. And so what they were testing was like 20 days or 30 days. It was a very limited amount of time. I want to say I'm not 100% accurate on the time frame exactly for how long they tested for whether or not once you got the vaccine, if you ended up in the hospital. But there were some issues with those tests that we could definitely break down at some point. Of how they were conducted, how short they were, and then they were like, yep, look, success, total success. Okay, so now they're being asked about, this one's a really important, it's a bit longer of a clip, but you've got to watch this because it's unbelievable. Basically, what they did not test for, the tests they did not conduct, the safety tests they should have conducted, and the fact that they cannot even explain why their vaccine causes things like myocarditis.
Given that, according to the Pfizer non-clinical report, there was no carcinogenic tests, no genotoxicity tests, no immunotoxicity tests, no interaction studies with other medicines, no longitudinal studies, and I note that in regards to pregnancy and lactation, that studies were conducted on rats. How can Pfizer say that the vaccine was unequivocally safe without qualifying any risks around the vaccine?
Senator, I don't have that report in front of me, so I'm afraid I can't talk to that. What I can say is that the TGA is one of the world's leading regulators.
Okay. Well, you can take my word for it. I'm happy to table this document. Okay. So it clearly stated that a number of tests were not conducted, okay, and given that those tests weren't conducted, and I accept it was a short time frame, I accept we had a short time frame, but that doesn't remove the risk that certain risks were not analysed, and you never highlighted those risks when the vaccine was rolled out.
Senator, I disagree with that statement. I think there was a very clear assessment of the benefit risk. The Therapeutic Goods Administration is a very thorough and very competent authority, perfectly able to reach a decision based on data which it reviews.
Okay. So initially when the vaccine was rolled out, myocarditis and pericarditis wasn't a recognised side effect. Does Pfizer understand why the vaccine causes myocarditis and pericarditis? And if not, how then can it guarantee that it's not also injuring other organs? And can you explain the process why the vaccine causes myocarditis and pericarditis?
I'll take that, Dr. Hewitt.
Sure.
Based on our clinical trials and pharmacovigilance data, as well as real-world evidence following the distribution now of billions of doses of vaccine, we retain confidence, strong confidence in the safety profile of the vaccine.
Sorry, Chair, point of order. I've asked, do you understand why it causes, I know that it's a low risk, I'm asking, do you understand why it causes myocarditis? I want you to explain to me why it causes myocarditis. Do you understand why it causes myocarditis?
Pfizer is aware of very rare reports of myocarditis and pericarditis that have been temporarily associated with vaccination.
Well, they're still ongoing for some people.
Senator Reddick, Dr. Through should answer the question. Thank you, Dr. Through.
According to public health experts and regulatory authorities around the globe, the number of reports of myocarditis remains small.
I'm not referring to the number of reports. I want you to explain to me the mechanism of how the vaccine causes myocarditis. Do you or do you not understand the mechanism of why the vaccine causes myocarditis? It looks to me like you don't. And if you don't understand it, why are you saying the vaccine is safe without qualifying the risks?
So, Senator Reddick, I think Dr. Through is actually about to get to that point. Whether people agree, whether there's agreement to his evidence or not, is another question for others to make a judgment on. But if Dr. Through, if you could again go to Senator Reddick's question.
Senator, all medicines, all therapeutic products and vaccines have benefits and have side effects as well. Looking at the totality of the evidence for Pfizer's COVID-19 vaccine, regulatory authorities, health authorities, experts globally, including in Australia within the Department of Health and the TGA, have maintained that the benefit-risk ratio...
That's not the question that I asked. I asked, can you explain why the vaccine causes myocarditis? Yes or no?
Senator, the benefit-risk profile...
Yes or no? So you clearly don't understand the pathway, do you? Because you can't explain it. I'm not referring to the cost-benefit analysis here. I'm referring to, do you understand the biochemical pathway as to why the vaccine causes damage to the heart?
Senator, I'm happy to take your question on notice and come back to the committee with whatever information we can provide. I might just clarify, I was not referring to a cost-benefit analysis in my previous response. I was referring to the benefit-risk ratio, and health authorities around the globe continue to recommend the benefits.
This isn't the question that I'm asking. Anyway.
Yeah, okay. So the fact that they don't know why it causes myocarditis and pericarditis is extremely alarming, because how can they then tell us confidently that these other vaccines they're rolling out, you know, they got the bivalent vaccine and every other iteration of the COVID vaccine, how can they tell us that, don't worry, you know, don't worry, it's totally safe? They can't say that. They should at least be trying to figure out why it's causing myocarditis and pericarditis, and maybe informing the public along the way what it is that they're discovering. But they're not. They're clearly just. Why would they even care at this point? Governments are still buying the vaccine. Governments are still telling people, take it every year, like what we're seeing here in the United States. Children, college students are still being required to take the vaccine in this country and other countries around the world. So it is extremely alarming that they do not know why it causes myocarditis and pericarditis. Okay, this is another bombshell we're about to watch of what was admitted during this hearing they admit that their employees had a different vaccine that was not a different batch of the vaccine, if it was even the vaccine at all, which is the real question around this, that was not reviewed by the TGA. And the TGA is Australia's version of the FDA. It's very similar. They have they operate the same way as the FDA. They do have a few more functions. They take on some of the functions of the Drug Enforcement Agency and a couple of other regulatory. So they have their scope is a little bit larger, but otherwise they do the job of the FDA. And it's important to note that the TGA is also user fee funded. So they also take money and are funded by the companies that they're regulating. So watch this clip of them admitting that their employees got a different untested batch, and here's why they're going to tell you they did that.
We've read that your vaccine mandate was using your own batch of vaccine, especially imported for Pfizer, which was not tested by the TGA. Is that correct?
Senator, so Pfizer undertook to import a batch of vaccine specifically for the employee vaccination program, and that was so that no vaccine would be taken from government stocks that was being delivered to clinics as needed.
Thank you.
Oh, sure. Yeah, we just wanted to make sure we weren't taking from the government supply. So that's why the government regulatory agency did not, in fact, test this batch, quality control test this batch. Maybe because, maybe it wasn't an actual batch. Maybe it was saline. Maybe they were doing some extra tests and they had some amped up version of the vaccine that they were testing out on their employees. I don't know what they were doing. We can only speculate. But it's odd, isn't it, that they would give their Australian employees a version of the vaccine that was not tested by the Australian regulatory body. That's a bit weird. Why did they do that? Maybe, it'd be really bad PR if an employee got sick and then went out in the world and said, I work for Pfizer, but I got sick. They'd be showing up with somewhere in a video with James O'Keefe. I just totally got sick. They made us take it. But instead, what did they get? Because we don't know, because the government didn't actually test that batch. Interesting and weird. Then they go on to say that they did mandate the vaccine and some of the people in their company left. Watch this.
Did you enforce your mandate on your colleagues, your employees? Did you enforce it? Did you sack anyone or refuse to pay anyone who refused to take the injection?
Senator, we aligned with the public health guidance. We permitted accommodations or exemptions for people that had specific medical or religious reasons that they did not or could not be vaccinated. A small number of colleagues departed the company.
Okay, him saying this is important because of the next clip. They said that no one was forced or no one was forced to take the vaccine. You won't believe how they justify this statement, which I've heard before, but watch this.
Dr. Theroux, you actually made a comment that no one was forced to have the vaccination. Who made the comment? Was it Dr. Theroux?
Senator, I believe I made that comment.
You made that comment? Right. Mm-hmm. You were in Australia during COVID-19. You must have been fully aware that people, nurses, doctors, people to have their jobs, to keep their jobs, were forced to have the vaccination. Now, do you retract your statement that they were not forced?
Senator, no, I believe firmly that nobody was forced to have a vaccine. Mandates or vaccine requirements are determined by governments and health authorities. I believe everybody was offered an opportunity to get a vaccine or not get a vaccine. I don't believe that anybody was forced to take a vaccine.
A lot of Australians will disagree with you on that one.
Yes, you were given the opportunity, don't you know, to take the vaccine. And if you lost your job, you lost your job. If you weren't able to go places, you weren't able to go places. You were given an opportunity to take the vaccine. Nobody was forced. So, yeah, I guess we're playing semantics here. Nobody was held down and the jab actually injected into them. That didn't happen to anybody that we know of. I'm sure there maybe, it depends on in certain facilities where a person didn't have the ability to speak for themselves, maybe that happened. But all in all, he's right, I guess, if we're going to play the game of semantics, that nobody was actually forced into the vaccine. They didn't come around and jab you, and grab you and jab you. Just absolutely ridiculous. You were instead given the opportunity to take their vaccine. So that was a hearing in Australia. We're getting just more answers. I would imagine there's going to be more hearings like this around the world as we move further and further away from the pandemic, because then people start to look back, reflect, and get angry and start to say, wait a minute, we were totally lied to, and things were not the way they were supposed to be, and we ended up losing a lot of freedoms. And we're going to see more hearings like this with more angry lawmakers, would be my guess. But bombshell, some revelations there, and just, again, just eyes glossing over hypocrisy and insanity from some of their answers. All right, I want to tell you guys about forpatriots.com. That's a company that's dedicated to helping Americans prepare for whatever comes their way. So whether it's a natural disaster or another pandemic, so help us, or even just supplies to get you through summer and winter, 4Patriot has the products you need. They offer a wide range of survival gear like thermal blankets, generators, water filtration kits. They also have many choices of survival food kits that range in size from 72-hour food kits to an entire year supply of food. And I'm a big proponent of that. I really think people should have a supply of food in their pantries to help get them through. Just, you never know, disaster could strike. I was raised in the state of Idaho where many around me believed in 1 year supply of food for each individual, but really you should at least at the minimum get yourself a 72-hour kit, but probably a 2 or 3 week kit, because even a natural disaster can knock out power. A pandemic can knock out the grocery store shelves, right? And so you might want a few weeks of food just on hand. So head to 4patriots.com, use the promo code Kim at checkout, and you're going to get 10% off your order. Again, that is 4patriots.com. Use the promo code Kim at checkout and get 10% off your order.